automaticity of SA node is about 100 beats per minute, while the normal heart rate at rest is 75. Why nerves innervate the heart? What's the mechanism? What are the changes in cardiac activity after stimulating vagus nerve? To settle these questions, we'll learn innervation of heart. Heart is the core of circulation. Its main function is pumping blood and promoting the flow. It's under the dual control of sympathetic nerve and vagus nerve. In this picture, the green curve represents cardiac sympathetic nerve. It originates from intermediate lateral column of 1 to 5 thoracic spinal colds. Exchange neuron in stellate ganglion and send out post-ganglion fiber to innervate heart. Sympathetic ends release norepinephrine, which binds with beta-1 receptor in myocardium, increasing the heart rate, myocardial contractility, and conductivity, which can be blocked by beta receptor blocker propranolol. The effect of each side of sympathetic nerve on heart is different. Because SA node is on the right side, the right sympathetic nerve mainly influences SA node, causing the change of heart rate, while the left one mainly innervates AV junction and ventricular muscle, causing the change of myocardial contractility and conductivity. When sympathetic nerve is excited, why does the heart activity increase? Norepinephrine is released from sympathetic nerve, binds with myocardial beta-1 receptor. Calcium channel on the cell membrane is phosphorylated through signal transduction, thereby the opening probability increased. In SA node, activation of T-type calcium channel promotes calcium influx in phase 4. Sodium influx through IF channel increased. Both of them accelerate the outer depolarization in phase 4, thereby increase heart rate. The activation of L-type calcium channel in AV junction can increase calcium influx, thereby increase the conductivity. In cardiomyocytes, activation of L-type calcium channel increased calcium influx in plateau. Calcium binds with ryanodine receptor on sarcoplasmic reticulum to open calcium channel, further increased intracellular calcium, which enhanced myocardial contractility. In this picture, the blue curve represents cardiac vagus nerve. It originates from umbilicus and dorsal nucleus in medulla oblongata, exchange neuron in ganglion of the heart, and sends out post-ganglion fiber to innervate the heart. Acetylcholine is released from vagus nerve and binds with M receptor on heart, decreasing heart rate, myocardial contractility, and conductivity. The effect of each side vagus on heart is also different. Like sympathetic nerve, the right vagus mainly affects SA node. The left vagus mainly affects AV conduction. When can vagus nerve inhibit cardiac activity? Acetylcholine is released from vagus nerve, binds with M receptor on myocardial cells to inhibit calcium channel through signal transduction. In addition, they are potassium channel sensitive to acetylcholine in myocardium, permitting potassium efflux. In SA node, P cells, the decrease of calcium and sodium influx in phase 4 slow down the outer depolarization, which is the main reason. In addition, potassium channel sensitive to acetylcholine was activated. Potassium efflux increased the maximum repolarization potential, also decreased the automaticity. The decrease of myocardial contractility was due to the inhibition of L-type calcium channel. At the same time, potassium channel was activated to fast the repolarization. The plateau was shortened, which also led to the decrease of calcium influx. As in AV junction, that the conducting is the slowest. The decrease of calcium influx reduced the velocity and amplitude of depolarization in slow response cell, so the conductivity decreased. Nerve, muscle, and other tissue maintain a certain continuous activity we call it tension. Using M receptor blocker atrophy or cutting off cardiac vagus nerve can increase heart rate. However, using beta-1 receptor blocker propranolol or cutting off cardiac sympathetic nerve can slow down the heart rate. This shows that both sympathetic nerve and the vagus nerve have tension all the time. They have opposite effect and co-regulate cardiac activity. SA node is the heart's normal pacing place. Its automaticity is about 100 beats per minute, while the normal heart rate at rest is only 75, because at rest, vagus tension is dominant. Inhibiting heart activity and making the heartbeat slower. Let's do a summary. The heart is innervated by both sympathetic and vagus nerve. Both nerves exist in body two sides. The right side mainly affecting SA nodes, and the left side mainly affecting AV junction and ventricular muscles. Norepinephrine released from sympathetic ends binds with beta-1 receptor and increase the opening of calcium channel to increase cardiac activity. Acetylcholine released from vagus nerve binds with M receptor, reduce the opening of calcium channel and increase the opening of potassium channel to decrease cardiac activity. At normal, both sympathetic and vagus nerves are in tension, but the vagus effect is more apparent. That's all for this class. Thank you for listening. See you.